Hi there, this is Dr. John Whitcomb talking about plasmalogens and how they drive coronary artery disease. That's a big claim, and let's see if I can prove it to you. Follow me with this logic. First of all, what are plasmalogens? They are precious fats that lay in the lipid, they constitute some 70% of the end plate axon and synapses in your brain. But there's a lot of nerve cells in your heart, and they're all over your heart too, in the conduction system of your heart. But plasmalogens are actually all over your body. They're in mitochondria, they're everywhere. And they have some very unique features. Their most important feature is they have a vinyl ether bond that is on the surface of the membrane, which means it's the first thing to soak up radical oxygen species, or reactive oxygen species. So when you have something that's oxidized, plasmalogens soak it up. Now, inevitably, as we grow older, plasmalogen levels drop. We're not sure why. We think it's because we're living in a oxidizing world. But how does that affect coronary artery disease? Well, let's just get down to what's the core problem in coronary artery disease. We now know that artery disease is actually a 30, 40-year illness. But it starts with the core problem called endothelial dysfunction. The lining of your arteries has a layer of cells that get damaged. They get oxidized from too much peroxide. That happens because you don't have enough plasmalogens. Those cells then get leaky. Instead of being close to each other and right next to each other, they get leaky, and there's spaces in between. And oxidized LDL particles can get into those spaces. You start getting lipid pools, the pools start accumulating, you start getting calcium around it, it starts plugging up the artery, it finally gets so big and inflamed that it ruptures. When it ruptures, a clot happens, and we call that a heart attack. Wait a minute, that's the end stage. The beginning of the stage actually happened 40 years earlier when you had those first French fries and you were sitting in your back seat of the minivan munching on French fries and eating high carbohydrate and trans fat riddled carbohydrates, fried. How do we know this is proof? Well, there's a whole bunch of articles that have been published in literature about this. There have been, for example, if you look at folks who have end-stage renal failure, there's a study on end-stage renal failure that shows that folks who have low plasmalogens are the ones who have heart attacks with very reliable predictability. Same thing happens with heart attacks in the journal Atherosclerosis, 2 studies in 2017, 2015. We can show, for example, high-density LDLs are meant to be protective, but they're protective only to the level to which you have adequate plasmalogens in the tissue. It's the lack of plasmalogens that are driving this. This might be the biggest discovery in coronary artery disease since time began. Isn't that interesting? It's not your cholesterol. It's your plasmalogens in your membranes. What would happen if you restore them to normal? The significant thing that's happened is we have now got the ability to A, measure them with a test from a company called prodrome.com that Dr. Goodenow, Diane Goodenow founded. We can measure them and we can replace them. And when you replace them, you put yourself back in this category of somebody who's safer. Well, what will work for me? Well, I measured mine. My plasmalogens were, I'm on track to be a 70-year-old, which means I'm on track to have a heart attack. Not interested in that. I've replaced my plasmalogens, and after 3 months, I was back to normal. What's most interesting is my C-reactive protein has been 2.5 for years. When I started taking Prodrome Neuro, Dr. Diane Goodenow's chief supplement, my C-reactive protein went to 0.3. My homocysteine has been 10. It was 14. I got it down to 10 with B vitamins, but I couldn't get it lower than 10. 2 months, I'm down to 7. Homocysteine and C-reactive protein are strong indicators of risk for coronary artery disease, and I just got mine normal. you could get yours normal too. This is Dr. John Whitcomb for News and Nutrition. Plasmalogens drive heart disease. You can't prove me otherwise.